My name is Dr. Talar Kharadjian and I work out of Oceanside office. I've been taking care of people who live with kidney disease for about 4 years. Your lab results that a nephrologist would be checking routinely are divided into probably 3 categories. So there will be the chemistries, there will be the cell counts, and there will be urine studies, okay? And so your blood chemistries, those kind of indirectly tell us how the function of the kidneys are working. So there will be the blood minerals. Sometimes we refer to them as electrolytes, things like sodium, potassium, calcium, chloride. You might have also heard your nephrologist talk about your acid level. That's like your acid base, the pH level of your blood. The last piece of your chemistry panel is something called GFR, glomerular filtration rate. And that is an estimate that is calculated from something called creatinine. Creatinine is a muscle breakdown product, so it's not a perfect test for everyone. What GFR is you can think of it as a percentage of kidney function. So if your GFR is 62, for example, that means it's estimating that at this moment in time, depending on the things that you were eating or drinking, that you have more or less 62% kidney function. As you monitor it over time, you can see, is my kidney function more or less changing? And that gives us a sense of what we can do in order to stabilize things. In terms of the cell counts, your kidneys, they talk to the rest of your body. And so kidneys are responsible for signaling the body to make new blood cells. So that's why some people who have kidney disease, particularly in the case of advanced kidney disease, might also have anemia, and that your nephrologist might be also talking about your blood counts for that reason, because the kidneys and your anemia are intertwined. The last part of the basic tests that nephrologists check are your urine studies. Urine tells us how your kidneys are doing. When your nephrologist is checking your urine studies, they're looking at the exact amount of protein in your urine. When it comes to protein in the urine, it also signals to us how much stress is on your kidney. The more the protein in the urine, then that means that unfortunately your kidneys are under more stress. If you're living with really high blood pressure, that's extra stress on the kidneys, and it will directly translate often into more protein in the urine. But once you get that under control, and again, there's a lot of options for good blood pressure control, you'll notice that the protein amount in your urine gets better. Your kidneys are also in line with your bone mineral health. Figuring out your calcium, phosphorus balance, those are part of the minerals that anyone needs for healthy bones. And so the kidneys are involved in just balancing those things and making sure that these things are in harmony in your body. So when people have kidney disease, and if the kidneys get weaker over time, sometimes the kidneys can't get rid of all these extra things that we get just by doing normal things, eating and drinking on a daily basis, just a normal diet. Unfortunately, your kidneys might, when you have later stage kidney disease, not be able to get rid of everything that you're taking in. Things like potassium or phosphorus might be things your nephrologist might talk to you about. It's not always true for everyone all the time, but some people have too much phosphorus or potassium that they're getting from their diet. It's important to balance your phosphorus needs with what your kidneys can handle, because if phosphorus is maintained at really high levels for a long time, over time phosphorus likes to get sticky and cause problems with kind of the heart disease, the blood vessels, and your bones. So that's why your nephrologist might be talking to you about getting your phosphorus under control. And then the really big thing that can make a difference is making sure that your blood pressure is really well controlled. Because the higher your blood pressure, then your kidneys have to work harder under those conditions. So bringing your blood pressure down lower into the 110s, 120s, as long as you're feeling well for that top number, would be a lowered stress environment for your kidneys to work in.